All right, the endocrine system. Now, the endocrine system is not a separate entity. The endocrine system is actually part of the psycho-neuro-immuno-endocrine system. We tend in Western medicine and in Western thinking to reduce things or to bring them down to common denominators in which to understand them. That is handy, but it's not necessarily good medicine because things do not exist in isolation in human beings. So what we're going to look at is the relationship here to some degree, but we're focusing on the endocrine system. Now, if you look at that, you can see there is a relationship between the psyche and the brain, the psyche and the autonomic nervous system, the immune system and the endocrine system, and they all relate in amongst themselves. So there are a number of variables here. Now, if you went a little bit further, you'd look at the nervous system. You'd look at the central nervous system. You'd look at the autonomic nervous system. You'd look at the vagal nervous system, the enteric nervous system. So these are all different aspects of the nervous system. So we look at the immune system. Well, we've got the innate immune system, the adaptive immune system. We've got the cellular immune system. We've got the humoral immune system. We've got thymal function, we've got bone marrow function. So there are a number of factors here. The endocrine system, there are 8 major endocrine glands, and we're looking at them. But there's also a great deal more. The stomach, for example, is the largest endocrine organ in the body and has an enormous influence. Hormones are signals, and they communicate. So there are a number of factors here, 8 plus. Now, each time you do that, you square it. And then we get to the psyche. How many subpersonalities are you walking around with today? So you get sort of an infinite number here when you start looking at the complexity of the PNIE. And when it comes to medicine, we also tend to, as Western people, be reductionist. I think it's part of our culture, part of our heritage. We do it automatically. We want to know what the disease is so that we can then find the treatment. However, it's not that simple. Well, unless you have, for example, a bacterial infection, and you know what kind of a bacteria it is, gram-negative, and then you use an antibiotic. Pretty straightforward. And so for acute diseases, it's pretty straightforward. But when we're talking about complex chronic diseases, we're talking about a number of factors. So for example, if this wasn't a bacterial infection, but for example, it was depression. Well, depression, there's a number of different kinds of depression. There is depression that's associated with anxiety. There's depression that's associated with anhedonia, lack of pleasure. There's a number of things. So you look at depression over these factors, then there is no single treatment, is there? You can be depressed because you have a B12 deficiency. Nothing to do with your psyche. Not directly. I mean, the psyche is at the effect of that. So when we talk today, and what I'm going to try to convey today, is that it isn't just a simple one-for-one. There are no treatments. I'm going to give you a lot